Hi Sheila, I'm Courtney. I'm the student nurse from St. Francis, and I'm going to do an assessment today. Can you tell me your name and date of birth?
Sheila Midmark, 9/22/1989.
Great. We did your vitals just recently, and everything was normal. Your breath sounds were clear, your heart sounds were clear too. Your temperature was in the normal range, and your pulse was good too. So everything sounded great. Today I'm going to ask you a few questions about your body since you've had your child. First off, I'm going to ask you about your breast, which is the B in the acronym. So have you had any pain, swelling, tenderness?
No, not really.
Are they soft or firm?
They're soft.
Good. Are your nipples cracking or bleeding or anything?
No.
Are you breastfeeding or bottle feeding?
Yep, I'm breastfeeding.
Good. How's that going?
It's going great.
Great. I'm going to pull down your blanket and I'm going to check your fundus, which is the top of your uterus. Okay. Your fundus is 2 fingers below the umbilicus. It's firm and midline. After you've had your child, now you've noticed you've had some bleeding. If your bleeding exceeds or you have cramping, there's a thing you can do called a fundal massage. So right here, you would take your hand and you would kind of move it back and forth on the fundus or the top of the uterus to kind of make it shrink and to bind the uterus back together to decrease the bleeding. Does that make sense?
Yeah.
Good. Also, I'm going to talk to you about your bladder. How often have you been going to the bathroom?
Pretty often. I just went in the past hour.
Okay. Try to go every 2 hours, even if you feel like you don't have to go, just because you've had a baby in you for so long that the pressure won't be there, so you might not feel like you have to go, but just try to go anyhow. Have you had any odor or burning or any hesitancy?
For what?
For urinating or peeing?
No, I haven't had any issues.
Okay. Sometimes if the bladder gets too distended, it will push the uterus up, which will cause bleeding too. So I just want to make sure that you are going to the bathroom every 2 hours. I'm going to check your bowel sounds.
Okay.
Good. Very active bowel sounds. Have you had a bowel movement yet?
Yeah.
Good. Are you also passing gas?
Yeah.
Great. Okay. I'm going to check your lochia or your bleeding. How often have you been changing your pad?
I change it when I go to the bathroom, so I changed it the last time I went.
Okay. If you have the entire pad completely full within an hour, make sure you rest and call the doctor.
Why is that?
Because that could be a sign of hemorrhaging. Okay. The blood is red. Small amount, no odor, no blood clots. So everything looks good there. Also, right now it's going to be red because it's in the first stage of the lochia process, and then it's going to become brownish, and then the last stage will be clear. So if you're in the clear or the brown stage and it goes back to bright red, make sure you rest, and if it fills up the pad, make sure you call your doctor. We're going to turn you on your side, okay?
Okay.
Are you comfortable? Okay. No hemorrhoids. The stitches are healing nicely. No redness, no swelling, no ecchymosis or bruising, no drainage, and it's all coming together very closed very well, so it's approximated. Your epidural site looks good. No signs of infection. No swelling, redness, heat, red. Here, let me fix your pad. Move it back down. I'm going to check out your legs now. Have you had any pain, swelling?
No.
Redness, anything like that? Anything that anyone has noticed in the past?
No.
Okay, I'm going to do the Homan sign, which checks for blood clots or DVTs. So just relax. Any pain?
No.
Good. I'm also going to check the Clonus sign. Good. Negative. Negative in both legs, which is wonderful.
Good.
Are you having any pain right now?
No.
Okay. So let's just talk about some of the things I educated you about. So make sure you void every 2 hours. Make sure if your pad is full within an hour that you change it. Rest and call the doctor. If you rest, call the doctor. Massage the fundus or the top of the uterus to relax it and stop the bleeding. Is there any questions that you have so far?
No.
Okay. If there is anything I can do for you, please let me know, okay?
Okay, thank you.
Okay. I'm out of my patient's room. I'm washing my hands again. My patient was very cooperative, very happy, very interested in learning. If she had a Foley catheter, I would check for redness, any burning or signs of infection. If she had an IV, I would check the IV site for redness, any signs of infection, also warmth or anything, any pain. Also, if she had a C-section, I would check the incision to make sure of Rita, just like I checked the episiotomy. So I check for redness, swelling, drainage, bruising, and if it's healing nicely and approximating, she's good to go.